Well, the days when, just falling on the playground and scraping your knee was the only reason to go see the school nurse are long gone. The role of school nurses is changing.
News Channel 5's Hannah McDonald is in the 5 Alert Center this morning with more. And Hannah, what is their role now in bridging the gap between health care and education?
They are that middleman. They are the representative for health at each school. And let's just say one of the nurses that I talked to that you'll hear from in this story says that her prior work in emergency rooms and ICUs prepared her.
They trust their nurses. They'll tell their nurses everything.
Visits to see the school nurse are happening on a daily basis for more and more kids.
The nurses do a lot of care with diabetic students, asthmatic students, students with cystic fibrosis.
Nurse Barbara Harrell coordinates health screenings that look like this for the 14,000 students in Rutherford County schools. She knows that every kid walking in doesn't have a clean bill of health.
Back in the day where students with certain medical conditions would be kept at home, they might have even been in an institution. That's just totally different now. We're seeing a lot of students who are surviving like very premature births or very critical childhood illnesses.
Nurse Andrea Kane spends most of her time at Christiana Elementary. She's seen kids' worlds rocked by a new, unfamiliar disease.
If they are diagnosed with diabetes, so their world is turned upside down. We're taking into account on days when they have physical education or extra recess, or if they're participating in a field day activity. We're constantly, monitoring and watching and developing a plan of care for them to be able to keep them at optimal health.
And Barbara says you can't really ask for much more. She says if nurses, pediatricians, and families coordinate, the majority of kids with medical conditions can go to school.
The nurse may have something in mind that would help the student succeed in the classroom that the teacher hasn't thought about. And really what nursing is doing, or school nursing is doing, is bridging the gap between healthcare and education. So it's a very unique role, but that's what we're doing, is just bridging that gap, and we want all of our students to have, academic success.
And the two nurses in this story, they do work in Rutherford County, but they were just named School Nurse of the Year and School Nurse Supervisor of the Year by the Tennessee Association of School Nurses, so congrats to them. In the 5 Alert Center, I'm Hannah McDonald, News Channel 5.